Not everyone in scrubs is a nurse or a doctor. So in my last video, we talked about radiology technician, and I just wanted to clarify because words do matter. We need to know all the jobs, and we need to call them by the right position. A radiology technician, on the other hand, typically refers to someone who maintains, repairs, or services the imaging equipment. They work more on the technical and mechanical side, not patient imaging in itself. So in healthcare, the person positioning the patient and taking the images is a radiology. So a radiology technician versus a technologist, let's talk about it. A radiology technologist is a licensed healthcare professional who performs imaging exams on a patient like the x-rays, CT scans, MRIs, and fluoroscopy, depending on their certification. Whereas a radiology technician, on the other hand, refers to someone who maintains, repairs, or services the imaging equipment. They work more on the technical and mechanical side and not the patient imaging. In healthcare, the person positioning the patient, taking the images, is a radiology technologist and not a technician. So these are different roles, different training. Both are important, but not the same job. Nursing school goes really fast over diagnostic tests, so let's break it down. So we're going to talk about PET scans and how they work. Now, a scan doesn't just show what the organs look like, they're going to show how they're working. So a PET scan is a positron emission tomography scan, and that uses a small amount of radioactive tracer to see how active different parts of the body are. Now, the tracer generally attaches to glucose, and then the body is going to use that for energy. After this tracer is injected, the tracer travels through the bloodstream and it gets taken up by cells that use more energy than others. These cells can be cancer cells, the heart muscle, and certain brain areas that use more glucose. These areas are then going to light up on the scan because they absorb more of the tracer, making them visible, right? The PET scanner detects a tiny signal, helping providers see the hotspots of the activity of the body. Now, as a nurse, you need to consider the radiation dose is small and controlled. You're going to also keep the patient NPO for at least 4 hours prior to this test so the glucose levels don't interfere. You're going to encourage hydration after the scan to flush the tracer through their system. You're going to check their pregnancy status and breastfeeding status because it can be transmitted to the fetus or to the infant. Now, PET scans, they don't show just the structure, they actually show the function and activity of the body. Okay, so for a PET scan, it's not an instant test. It is a process, and the timing matters. From the radioactive tracer, this is generally given through a small IV injection. So you have to make sure you have at least a 20 gauge IV, peripheral IV, most likely, to administer the tracer. Now, the tracer has to be administered at least about 30 to 60 minutes before the test to take full effect and for the equipment to pick it up on the machine. So this allows the tracer to be absorbed and circulated throughout the bloodstream by the active cells. During this time, the patient is able to rest, stay still, and avoid talking too much or moving too much, just because the muscle activity can affect the results. Once the tracer has been processed and had time to work, the patient is placed on the scanner, and the scan can take anywhere from 20 to 45 minutes, depending on how big the area that's being examined is. So from start to finish, the PET scan can actually take about an hour and a half to 2 hours. So again, as a nurse, you need to verify your IV access is patent, is stressed, it's ready to go. Ensure the patient has followed NPO orders at least 4 hours prior to the exam. Monitor their comfort and anxiety during the wait, and encourage hydration after the scan to help flush the tracer. So the tracer actually does the work quietly, and the scan reads the activity. Nursing school doesn't spend much time on diagnostic tests, and as a new nurse, it's critical that you understand these tests. So let's talk about stress tests. Stress tests shows how the heart performs under stress. It checks how well the heart works when it's pushed, either through exercise or with medication. So with the exercise version of a stress test, the patient is asked to walk on a treadmill while their heart activity is being monitored. As far as With the chemical or medication stress test, the patient is given medication and then asked to perform exercise while their heart activity is being monitored. Now, these stress tests are ordered to evaluate chest pain, shortness of breath, or suspected coronary artery disease, or abnormal EKG findings. As a nurse, you need to consider the patient's ability to exercise safely and tolerate exercise. Monitor their EKG, their blood pressure, and their symptoms. You'll need to hold certain medications like a beta blocker before the procedure, and then be prepared to stop the test if their symptoms worsen. So, a stress test does not show blockages directly, it shows how the heart responds to activity. Nursing school goes over diagnostic tests so fast, but as a new nurse, it's so important that you understand it. So let's talk about why some tests need contrast and what it is, and what to consider if your patient has a test, most likely a CT, ordered with contrast. So contrast is not extra, it's intentional. Contrast is a special dye that's given through your IV to help certain parts of the body show up more clearly on the imaging. Contrast helps highlight blood vessels, organs, inflammation, tumors, and areas of infection. It makes it easier for the providers to see what's abnormal instead of guessing. Contrast is most commonly used with CT scans to highlight blood vessels, organs, inflammation, bleeding, and tumors. MRI scans to better visualize the soft tissue, brain lesions, spine issues, or tumors, and CT angiograms to look at blood vessels and the blockage. Now, some studies do not need contrast, like a CT scan checking for bleeding or kidney stones. That also can be for stroke. Sometimes you're not going to do CT with contrast. Many X-rays and ultrasounds do not use contrast. Some MRIs, depending on the question or the area of the body that's being assessed. Contrast, it sharpens the picture, but safety always comes first. Nursing school goes over diagnostic tests so fast, but as a new nurse, it's important that you understand this topic. Let's talk about CT tests and what's the difference between the ones with contrast and the ones without. What are they really looking for? So it's the same scan with two very different purposes. A CT scan without contrast, it takes images as is. And a CT scan with contrast uses the dye, which is a contrast, through the IV to make certain areas stand out. So when a CT is done without contrast, this is generally to look for acute bleeding such as head trauma or even a stroke, a hemorrhagic stroke, kidney stones, bone fractures, or some initial emergency scans. Now, a CT done with contrast, this is used to evaluate blood vessels and blood flow. And that can be hmm, when a CT is done with contrast, this is used to evaluate blood vessels and blood flow, infections or inflammation, tumors or masses, organ injury, and CT angiograms are used to look for clots or blockages. So for a nurse, being the nurse, you'll need to consider what's your patient's allergies. Are they allergic to contrast, iodine, or shellfish? Review kidney function. Look at their BUN, their creatinine, and urine output. Ensure that they have good IV access, at least a 20 gauge or larger. And you'll monitor for contrast reactions after it was administered. And then you want the patient to be hydrated to make sure they flush out the contrast out of their system. So without contrast, it's going to find obvious problems and it's going to be quicker. With contrast, it's going to show the detail and the blood flow. CT without contrast usually requires less prep. Nursing school goes over diagnostic tests really quickly, but it's essential that you understand this as a new nurse. Let's talk about why your patients are required to be NPO before test or procedure. We're going to talk about aspiration. So, being NPO before a test or procedure is not just about rules or someone being mean, it's actually about protecting the patient's airway. So, NPO means nothing by mouth, no food or drink for a specific amount of time before a test or procedure. This generally is at least 4 hours before the test or procedure. So when patients eat or drink before certain tests, there's a risk for aspiration. Aspiration basically means that the food or drink goes into the lungs instead of going into the stomach where it should be. And this chance could be increased by laying flat during a procedure or a test. Aspiration risks increase during testing procedures because it requires the patients to lie flat, receive sedation or medications, get contrast dye, which can cause nausea. So sedation and positioning can weaken the gag reflex, and it slows protective airway responses, making aspiration more likely. So if aspiration happens, it actually leads to breathing problems, aspiration pneumonia, infection, or respiratory distress, especially in older patients or patients who are already really sick. Now, tests that are required to be NPO before generally are CT or MRI with contrast, a PET scan, certain ultrasounds like gallbladder studies, procedures involving sedation like a TEE or cardiac cath. It's important as a nurse that you take NPO seriously because it's a safety barrier put in place for your patients. If NPO instructions are not followed, then tests can be delayed or canceled. And it's not difficult, but it's also to prevent the harm of your patient. So NPO is not about inconvenience, it's actually to keep the patient safe.